Today, for the first time in history, half of the world's population lives in cities. The number of urban residents is growing, and it is estimated that it will increase by more than 2 billion people by 2030. Currently, 1 billion people languish in informal settlements and slums, and this is expected to double by 2030. In many cases, especially in the developing world, the speed of urbanization has outpaced the ability of governments to build essential infrastructure. In the Philippines, it is estimated that around 60% of Filipinos now live in urban settings. About 28% live in squatter and slum settlements and suffer poor living conditions. Metro Manila is the largest urban center in the Philippines. It is home to over 12 million people and accounts for 36% of the Philippines' total urban population. An additional 10% of the urban population lives in the next four largest metropolitan regions. These are Davao City and Metro Cebu, both with over 1 million residents, plus Metro Angeles and Zamboanga City, with over 500,000 inhabitants each. The number of Philippine urban centers with smaller populations has also increased. These also need to be looked at in addition to the megacities. Global studies indicate that growth of urban populations will be most felt in these smaller cities. While urbanization can be the beacon of opportunity for economic growth and social progress, there are issues and challenges that need to be addressed to improve health outcomes and make cities more livable. These issues relate to inadequate infrastructure, overcrowding and congestion, strained basic urban services such as health and sanitation, water and air pollution, slums and squatter settlements, and others. The issue of urban health equity is foremost, as the urban poor is often a disadvantaged lot. The attributes of urban life like political voice, secure housing, safety, education, health services, and decent transport are often monopolized by a privileged few. The poor, on the other hand, are often socially excluded. They face challenges like inability to pay for goods and services, lack of social support systems, unsafe living and working conditions, discrimination, isolation, and powerlessness. Being poor is not just living on less than $1 a day. Being poor means lack of opportunities, lack of capabilities, lack of security, lack of empowerment, and lack of health-supporting living environment. The poorer one is, the worse his health is. The urban poor suffer from unfavorable living conditions and often cannot afford the high prohibitive cost of health services. The urban poor face illnesses and premature deaths from preventable diseases due to lack of safe drinking water, sanitation, health facilities, safety, security, and health information. The urban poor are constantly exposed to social and economic determinants that influence health status and other outcomes. It is often asked, why do we keep treating people for illness, only to send them back to the conditions that created illness in the first place? Addressing social determinants will help provide the answer to the question. Particular health issues affecting the urban poor include communicable diseases, which will continue to be the most important killers among the poor. The spread of infectious diseases related to high population density is also a major concern. Changing lifestyles on unhealthy diet, physical inactivity, tobacco and alcohol use in urban settings are bringing about increase in cases and deaths from non-communicable diseases. Obesity is also emerging as a major risk. Increasing motor vehicles and the likelihood of inadequate infrastructure are making air pollution and accidents in road traffic more common than in the past. These are some of the direct health issues that the urban residents, particularly the poor, are often exposed to. All in all, they bring about poorer health outcomes and poorer quality of life among the urban poor. More than ever, there is a need to address the health situation of the urban population, particularly the urban slums. We need to strengthen urban health systems and improve health status, ensure financial risk protection, and provide client-responsive services among urban residents. We need to narrow the equity gap in cities and address the social determinants of health. To do all these, we need to empower communities and encourage intersectoral actions to address the urban health challenges. The big task is ahead of us. We need to address the urban health challenge now.